Hello everyone, welcome back to the channel. In the last video we have talked about the timetable, how to start our preparation, okay? And in this video we are going to split each and every subject. So in this video I'm going to talk exclusively about anatomy. So what are the topics to read from the textbook and what are the topics which is given in your basic guides and how to go about the preparation and what to read and what not to read. In this way we will divide all the 20 subjects so that it will give you a broad idea of how you should frame a timetable and how you should allocate a time for a particular topic which you feel is very important or very difficult. So if you look at anatomy, so first I'll give you the list of topics which is given or which you should read from the textbook. Okay, so these are all the things which you should read from the textbooks. So what are the topic I say now? The red ones you should read from the textbooks. So the first one, if you see, the bones of the skull. So the bones of the skull, if you see, there are unpaired and paired, right? So you should be aware of all those things and what are the communicating aspects of it. So if you look at paired, it's going to be the parietal and the temporal, and the unpaired is going to be the frontal ethmoidal. Right? You have to know about all the communicating aspects of each bone and what are the ossifications of it and so on. So the next one is going to be the structures passing through each foramen. So this is very important, the most crucial thing, because it will be very volatile. So one advice, if you ask me to remember this, I'll tell you, write in a piece of paper of particular foramen and the structures passing through the foramen, the nerves, the vessels, and the heart and the blood supply, right? So what are the arteries or what are the nerves, what are veins passing through a particular foramen? You write in a piece of paper and you stick it to the walls, and you see that on a day-to-day basis so that you can easily remember that. This is one of the way you can remember the structures passing through the foramen. So the next one, if you see, it is going to be the interior of the skull. The interior of the skull, if you see, it is going to be the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. So the anterior, middle, and the posterior cranial fossa, it's going to be very important aspects, and what are the structures present there, you should definitely remember it. And the next one is going to be the orbit, the foramens related to the orbit, and what are the vessels and the structures passing through the orbit. And the derivatives, the ectodermal, the endodermal, and the mesodermal derivatives, you should be aware. And the maxilla and the mandible, so how it develops and what are the foramens in the maxilla and mandible, what are the articulations of the maxilla and mandible, and what are the the clinical aspect of it, right? And clinical aspect as well as the ossification of it. So these are all the things you have to read. And hyoid bone, you have to record the clinical anatomy as well as the applied anatomy. And the cervical vertebrae, the typical cervical vertebrae, and 1, 2, and 7 are particularly important. Okay, so the scalp, what are the layers of the scalp and what are the blood supply, the nerve supply, right? So that is very important aspect of the scalp as well as the applied anatomy of the scalp. There will be profuse bleeding, right? So you should understand, you should know why it occurs. So coming to the face is very important because you have to read about the motor supply as well as the sensory supply as well as the muscles and the nerves, especially the facial nerve. You will read about the facial nerve as well as the artery, right? That is very important. So face is very important. You should get into the depth of the face, the facial muscles. What are the particular muscle has a particular function, right? You should be aware of that. So the lacrimal apparatus, yes, the deep cervical fascia, that is your the investing layer as well as the the pretracheal, the prevertebral, and the carotid sheath, buccopharyngeal fascia, pharyngobasilar fascia. So these are all the few things which will come under the deep cervical fascia. The deep cervical fascia is very important, and it is, some students will feel a little bit difficult. So whatever topics you feel difficult, you just write it in a piece of paper, you just stick it to the walls, and you constantly revise that. So coming to the triangles of the neck, yes, you should know about the anterior triangles, the posterior triangles, and the anterior triangles again as your submental, the digastric triangles, the posterior triangle, and then the suboccipital triangles. Okay, so the triangles of the neck is very important, and in the triangles you should also read about the sternocleidomastoid muscles. Next one is going to be the muscles of the back, and then the contents of the vertebral canal. The contents of the vertebral canal includes mainly the vertebral artery, and then the vertebral pia mater, dura, and the arachnoid mater. Okay, the vertebral pia, dura, and arachnoid maters. And then the next one is a very important thing, the cranial nerves. You should be aware of all the 12 cranial nerves, starting from the olfactory to the hypoglossal nerves. So what are the things you should learn about a particular nerve is, you should definitely learn the nucleus of a particular nerve, what are the nucleus present in, and the functional component, the general visceral afferent or general somatic afferent, and then the functional component of a nerve, and then the intracranial aspect of it and the extracranial aspect of it, as well as the applied anatomy. What happens if a particular nerve is damaged, or how to preserve a particular nerve in a particular surgery. So next one will be the most important, the middle meningeal artery. What are the branches of the middle meningeal artery and what are the branches supply? The next one will be the extraocular muscles, the superior rectus, the medial rectus, lateral rectus, superior oblique, inferior oblique, levator palpebrae superioris, and what all it does and what are the nerve supply of it. So basically superiors, they will intort, and their recti will obey the names. So I know you will every student will learn this in their own way, so you just learn that. And the parotid gland, if you see, it is one of the most important gland pertaining to our field, especially because parotid gland, you have to learn about the surface markings and the structures passing through the surfaces, as well as the facial nerve will come here, okay, and also the applied aspect of it, okay, applied aspect. And the next one is going to be the very important maxillary artery, the first, second and the third branches, and also the subclavian artery. And the TMJ, you have to learn about the movements of the TMJ, the muscles associated with the TMJ, and articulating surfaces, as well as the applied anatomy of the TMJ. TMJ is next most important to the mandible parotid. Okay, so the ganglions, if you see, the trigeminal ganglion, the optic ganglion, submandibular ganglions. So what are the nerves passing through each ganglions, and also the secretomotor pathways. Okay, the secretomotor pathways. The next one will be the thyroid, parathyroid and the thymus glands. So you have to learn about the development of each gland and also the applied aspect of it. So the common carotid artery, internal carotid artery, external carotid artery. So you have to learn the branches of it, which you would have already learned from the above topics. So you should be very much aware of what are all the branches of these internal, external, as well as the common carotid arteries. And the next one will be the internal jugular vein. It is also a very important thing. The cervical flexus, which will include the phrenic nerve and also the cervical sympathetic ganglion. So the next one will be the trachea and the esophagus. So if you look at the trachea and esophagus, you have to learn about the, a little bit, not too much in it. So you have to look about the clinical aspect of trachea and esophagus. And the lymph nodes of head and neck, this is very important. So what are all the lymph nodes involved? And the prevertebral muscles of the vertebral artery is also important. So your circle of Willis, you have to also learn about the circle of Willis. Okay, circle of Willis. And then the development of the teeth and the palate. So palate, you have to talk about the hard palate, the soft palate, each one, how it develops, what are the muscles associated with the soft and hard palate, what are the applied aspect of it. And the pharynx and the larynx, the pharyngeal muscles, the laryngeal muscles, and the outer pharynx and larynx develop. And then you should know about the the Killian's dehiscence, as well as the applied aspect of the pharynx and the larynx. So next one is the paranasal sinuses, the typical 4 paranasal sinuses, and you have already read the maxillary sinus and osteology aspect. So the pterygopalatine fossa and the pterygopalatine ganglion, the pterygopalatine fossa is where your maxillary nerve enters. Okay, so you should be aware of the pterygopalatine fossa and ganglion, what actually it is. And the tongue, what are the muscles of tongue, the development of tongue, the nerve supply, blood supply, as well as the clinical aspect of tongue. Tongue is also very important. So if you look at ear, you have to talk about the internal ear. Okay, the internal ear, the middle ear. The middle ear is the most important. Okay, the most important thing is the middle ear. Okay, so if you look at the middle ear, you have a few nerves which enters the middle ear and exits. So the middle ear, it is a bit complicated. You definitely have upper hand on the middle ear, and also the external ear. A few important topics in external ear as well. So the eyeball, you have to talk about the outer coat, the middle coat, as well as the inner coat. Okay, the outer, which includes your cornea or sclera, and the middle coat, which includes your choroids or the iris, and the inner is your retina, right? So you should, and in addition to that, you should definitely know about the vitreous humor and the aqueous humor and how it develops. Okay, this is what you have to learn in eyeball. The CSF, next coming to the neuroanatomy, CSF, how much quantity of CSF is usually generated, you should be aware. And you should know about the basics of neuroanatomy, like the forebrain, midbrain and hindbrain. Most of them would have been aware of that. Starting from the basics, you should learn about the spinal cord as well. The spinal cord, you have to know about the ascending as well as the descending tracts. okay, the ascending and the descending tracts, and the brainstem, the medulla oblongata, the pons, as well as the midbrain. This is the brainstem. And the nuclei of the cranial nerves. As I said, you should know the functional component, the special visceral afferents, the general visceral afferent, general somatic afferent. So you should know all the functional components and what are the nerves which has that particular functional component. That's very, very important. And the cerebellum. The cerebellum, you should know about the clinical aspect of the cerebellum, and the fourth ventricle, the third ventricle, and the lateral ventricles. Very important as far as the neuroanatomy is concerned. And the cerebrum, you will deal about the thalamus, hypothalamus, the corpus striatum, corpus callosum. Those are all the very important things which you will read come under the cerebrum. And the pathways of pain, the temperature, the touch, olfactory, auditory, right? So taste. So all these pathways you should be thorough and it should be in your fingertips. So these are all the various things which you should read from the textbooks. Okay, these are all things which you should read from the textbooks. Okay, now coming to the pulse of the dentist. So if you see here, you will have around osteology, salivary thyroid glands, mouth, pharynx, larynx, tongue, vascular supply of head and neck, nerve supply of head and neck, muscles of head and neck, embryology, miscellaneous, as well as synopsis. So these are all the few things which is given in your pulse or dentist. And I have written up the MCQs which are given in a particular topic. Okay, so if you look at all these topics as well as the MCQ, totally it will come under 563 MCQs. So 563 MCQs is what you get exposed to anatomy in pulse or dentist. So 563 MCQs plus your synopsis. This will be your 563 MCQs plus synopsis is your pulse. So if you look at the timetable which is framed by me, I have given 5 to 7 days of anatomy. Okay, 5 to 7 days of anatomy. If we take calculation, approximately you will read 100 MCQs, or you should read 100 MCQs per day, which will include around 80-85 MCQs plus your synopsis aspect. Okay, and your previous year MCQs plus the textbook notes, textbook topics, which I have mentioned before previously. These are all the textbook topics. So this is the basic split up or basic topics which you should read in anatomy. And I have an image of it. If you want, you just DM me to my Instagram page. I will send you the image of all the topics. You just write it down and then you tick whatever you read and you make sure you cover all the topics. That is what I have said in the previous videos. You should have a complete knowledge about all the topics. You should cover everything. That is what will be missing in your basic guides, which you should fulfill from the textbooks, right? So once you correlate this and you read, that is going to be the best thing you can ever see. Okay, now thank you for watching this video, and the next video will look about another subject, the split out of another subject. I'll give you the list of topics, what are all the topics from the textbook and what are the topics which is given in your pulse, and the total number of estimated days, how to split about it. Okay, so I hope you like this video, and do share with your friends if you like this video, and thank you for watching this. Have a great day.